Is there a link between autism regression and epilepsy? Have you ever wondered if there is a connection between autism regression and epilepsy? This is a topic that raises many questions for parents and caregivers. Autism regression refers to a loss of skills that a child has previously developed, particularly in social communication, language, or behavior. This typically happens in early childhood and can be concerning for families. On the other hand, epilepsy is a neurological condition that causes recurrent seizures due to abnormal electrical activity in the brain. Research shows that autism and epilepsy often occur together. In fact, the rates of epilepsy in autistic individuals are significantly higher than in the general population. Studies suggest that around 10 to 26% of children with autism may develop epilepsy, especially as they grow older or if they have intellectual disabilities. This connection hints at shared neurological factors that may affect brain development and excitability. When we look specifically at autism regression, some children who lose language or social skills also show abnormal brain activity detectable by an electroencephalogram. However, the type of brain activity seen in autism regression can differ from that in epilepsy syndromes like Landau-Kleffner syndrome, which primarily involves language regression. In autism, regression can affect various areas, including social communication and repetitive behaviors. In contrast, Landau-Kleffner syndrome mainly focuses on language skills. While children with isolated language regression may have a higher incidence of epilepsy, the frequency of epilepsy in children with autism regression is lower but still more common than in the general population. It is important to note that there is no clear evidence that epilepsy causes autism or autism regression. Studies have not shown that treating epileptic activity in autistic children improves core autism symptoms, such as social communication or behavior. Understanding that epilepsy and regression can happen together is vital, but they are separate issues. Not every child with autism regression has epilepsy, and not all children with epilepsy will develop autism or regression. If a child shows signs of regression, a thorough evaluation is essential. This should include a neurological assessment and possibly an electroencephalogram to check for any epileptic activity. Early detection and treatment of epilepsy are important for a child's overall health and development. Families and healthcare providers should be aware of the increased risk of epilepsy in autistic individuals, particularly those who experience regression. This awareness can help ensure proper monitoring and support for these children. In summary, while there is a recognized link between autism and epilepsy, particularly in cases of regression, epilepsy is not the direct cause of autism regression. Treatment for epilepsy does not necessarily lead to improvements in autism-related developmental outcomes. Understanding this relationship can help guide care and support for families navigating these challenges.